Do you know what hypertension is and what causes it? Imagine a busy city, the rush of traffic, the hustle and bustle of pedestrians, the honking of horns, and the constant, almost deafening hum of activity. Now picture that city within your body, with highways of blood vessels and the constant flow of life's vital fuel, blood. Just like city traffic, the flow of blood needs to be regulated. If it's too high, we have a problem. And that problem is hypertension. Commonly known as high blood pressure, hypertension is a long-term medical condition where the pressure of the blood against your artery walls is consistently too high. Think of it like a water hose. If the pressure is too strong, it can damage the hose over time. In the same way, high blood pressure can harm your arteries and lead to health issues like heart disease. But here's the sneaky thing about hypertension. It's often called a silent killer. Why? Because it doesn't always show noticeable symptoms. You could be living with this condition for years and not even know it. It's like a ticking time bomb, quietly causing damage that could lead to severe health complications. Hypertension is more common than you might think. It affects a significant percentage of adults worldwide, and its prevalence increases with age. While the exact cause of hypertension isn't always clear, it is often linked to factors such as genetics, diet, and lifestyle. You might be wondering, how is it diagnosed? Well, it's usually detected during routine checkups. If your blood pressure readings are consistently high over a period of time, you could be diagnosed with hypertension. But don't panic just yet. Hypertension is manageable, and there are many ways to control it, from medication to lifestyle changes. Now that we've identified what hypertension is, let's delve into the factors causing it. Ever wondered what could lead to hypertension? Here are some common causes. Let's begin with essential or primary hypertension, which accounts for over 90% of all cases. The exact cause of this type remains undetermined, though several predisposing factors have been identified. These include a family history of hypertension, obesity, particularly abdominal obesity, excessive alcohol consumption, a high-stress lifestyle, and a sedentary lifestyle. Other factors include smoking, being male, being over the age of 30, a diet high in salt and fat, African American ancestry, and dyslipidemia, which is an abnormal amount of lipids in the blood. Moving on to secondary hypertension, this type accounts for about 10% of cases and can be traced back to a specific cause or condition. One such cause is renal or renovascular hypertension, which can result from conditions like glomerulonephritis, pyelonephritis, or polycystic kidney disease. Endocrine disorders can also lead to secondary hypertension. Some examples include primary hyperaldosteronism, Pheochromocytoma, Cushing syndrome, and hyperthyroidism or hyperparathyroidism. Even hypercalcemia or high calcium levels can be a cause. Vascular issues like coarctation of the aorta and renal artery stenosis are another cause. Secondary hypertension can also be drug-induced. Estrogens, monoamine oxidase inhibitors, cocaine, steroids, lithium, amphetamines, non-steroidal anti-inflammatory drugs, decongestants, and alcohol can all contribute. We should also be aware of labile or white coat hypertension. This type of hypertension is characterized by fluctuating blood pressure readings, often due to the stress of being in a medical setting. Remember, understanding these causes is critical in both the prevention and management of hypertension. It allows individuals to make lifestyle changes where possible and helps healthcare professionals in determining the best course of treatment. Having understood the causes, we now move on to the serious complications that can arise from untreated hypertension. Unchecked hypertension can lead to medical emergencies. Let's understand what they are. Hypertensive emergencies are critical situations where blood pressure elevations are associated with acute target organ damage. These can be life-threatening if not promptly addressed. One such emergency is malignant hypertension, characterized by severely elevated blood pressure and damage to the organs, especially the kidneys and heart. Then we have cerebrovascular emergencies. Hypertensive encephalopathy, for instance, is a syndrome characterized by severe hypertension, headache, nausea, and altered consciousness. We also encounter stroke with severe hypertension, intracerebral hemorrhage, and subarachnoid hemorrhage. In the realm of cardiac emergencies, we find acute aortic dissection, acute refractory left ventricular failure, and acute myocardial infarction with persistent ischemic pain after coronary artery bypass grafting, also known as KBG. Renal crises can also occur, such as acute glomerulonephritis, renal crises from collagen vascular diseases, and severe hypertension following renal transplantation. Excessive circulating catecholamines can lead to emergencies too, such as Pheochromocytoma, a rare tumor that releases hormones causing episodic or persistent hypertension. Also, watch out for situations like rebound hypertension after cessation of antihypertensive drugs. Eclampsia, a severe complication of pregnancy, is another hypertensive emergency. It's characterized by seizures in a patient with preeclampsia. Surgical emergencies include severe hypertension prior to emergent surgery, severe post-operative hypertension, and post-operative bleeding from vascular suture lines. Severe hypertension following severe burns can also lead to life-threatening complications. And let's not forget severe epistaxis or nosebleeds, often aggravated by hypertension. Remember, timely diagnosis and treatment can prevent these emergencies. It's vital to keep a check on your blood pressure and maintain a healthy lifestyle to avoid landing in these critical situations. Stay aware, stay informed, and most importantly, stay healthy. We hope you found this video informative and helpful. As we navigate through the complexities of hypertension, it's imperative to stay informed and proactive about your health. If you appreciate our efforts to bring such crucial health-related content, please subscribe now to join our community. Your support encourages us to continue creating high-quality, accessible content on important medical topics. Don't forget to give this video a thumbs up if you found it useful. Our channel, Medicine Health 360, is dedicated to delivering the latest and most comprehensive medical and health knowledge in a simple, easy-to-understand format. We aim to empower everyone for better health and a better life. With your support, we can continue to make this possible. Thank you for watching. Stay healthy, stay informed, and remember, your health is in your hands.